The political argument is overwhelming scientific reason at the moment, and that this requires ordinary South Africans to stand up, wake up, and to seek truth from facts.
What is happening with South Africa's COVID regulations? On the 4th of May, the Department of Health hastily drove through new regulations. We covered that in an earlier video. But joining me to discuss some of the confusion around these regulations is Gabriel Crouse. Gabriel, I'm hoping that you can shine some light in the darkness here. What exactly is happening with these new health restrictions?
So right off the bat, the public was told by inter alia Deputy Director General of the Department of Health, Nicholas Crisp, that schools would be exempt from the mask mandate. It turns out, on a plain English reading of the regulations, schools are actually obliged to comply with the mask mandate, meaning all school children are supposed to wear masks all day indoors, but they are exempt from the social distancing mandate. Unfortunately, Dr. Crisp doesn't seem to have read those regulations before he spoke about them in public. He apologized later on, and the health department put out a clear message to say that South Africa is basically one of the only countries on earth where school children are still obliged to mask. We have 50% capacity limits on outdoor and indoor events that are very large. And we have vaccine pass mandates for outdoor events that are over 2,000 people in attendance. So those three things, the vaccine pass, the capacity limits on business and places of worship, and the mask mandate indoors, were level 1 lockdown restrictions. I think it's appropriate to say lockdown level 1 lives on, although the name has been dropped.
All right, so Gabriel, you wrote a piece for News 24, and we'll link to that in the description below, where you highlighted that Namibia, Kenya, these countries have ended mask mandates, and there's a list of 28 non-exhaustive countries there, non-exhaustive list of countries that you've also highlighted. Those are outside of Africa that have also ended mask mandates. Do you think that South Africa is lagging behind the rest of the world here?
Absolutely, David. Curiously enough, on Sunday past, May 15th, Denmark completely ended its vaccination program. Why? Well, the government said everyone who's going to get vaccinated has been vaccinated already. So we're not going to keep trying to push them onto people. We're not going to keep rolling them out. South Africa is still very actively trying to advertise more vaccination, in spite of the fact that it seems like 9 out of 10 South Africans have already been infected with COVID-19. That's according to Professor Shabir Mahdi, who I quote in the piece you mentioned. And the fact that it looks like the return on investment for encouraging vaccination continues to diminish. That's just on the basis of the fact that it seems people, many people have made up their minds against it. Nevertheless, South Africa is trying to impose vaccine passes, which don't respect convalescence as one of the options that might get you through the door, which is the best practice internationally. That's what Germany did, and so on. We're still trying to enforce mask mandates, even though, and this is probably the most crucial fact that I draw attention to, in the UK, COVID is now less deadly than the flu because of the number of people that have been vaccinated or infected. Professor Shabir Mahdi has said that similar estimates have been made for South Africa, partly through vaccination, but largely through infection. We're in a similar position, even though we are in that place where deaths and cases have demonstrably divorced. We nevertheless have a government that is trying to force people to comply in order to stop the virus, which is most bizarre, given that, as Shabir Mahdi says, if those restrictions worked in the first place, we wouldn't already be in a position where 9 out of 10 South Africans have been infected at least once.
All right. Now, Gabriel, this is impacting society, but also economic activity. And I think a good example of this recently was the Nampo Trade Festival. That's an agricultural fair where farmers from around the country gather. There are all sorts of quite onerous COVID restrictions on that event. What does this tell us about the cumbersome nature of these ongoing regulations?
It tells us that government is really not in line with most South Africans who think that unemployment is the biggest priority issue in the country and that everything must be done to address unemployment. Government restrictions are getting in the way of the NAMPO trade fair business. It's worth noting that it's billed as the biggest agricultural trade show in the Southern Hemisphere. So it's not just South Africans who gather there. It's people from across the subcontinent of Africa, as well as Argentina, Brazil, New Zealand, Australia. The sheep shearing contest is an international affair and somewhat amusing. But the business deals that are made there are very serious. They determine the harvests to come. Major agricultural hardware trade takes place there. And anything that inhibits that trade is worrisome. Now, I think the biggest impact is going to be on small businesses, which rely on heavy foot traffic to sell arts and crafts and food. Some of these are non-profits organizations, and they depend on 20,000 plus foot traffic per day at NAMPO. Reports on the ground suggest that the numbers of people going through is much lower, and that part of the reason for that is that for a lot of people, they have to pay for a rapid antigen test that's $150 on top of the 100 Rand for the price of the ticket. The event suddenly goes from being affordable and fun to a question mark. Jobs in agriculture, oddly enough, one of the only sectors where jobs have grown over the pandemic period, grown by 7%, whereas most of South Africa has seen job losses, in fact, a net loss of 1.9 million. And I think it's no coincidence that outside of events like NAMPO, the agricultural sector is the one that is the most protected, just by circumstance, from irrational COVID regulations that fail to stop the virus, but really succeed in stopping the flow of money and therefore stopping the growth of jobs.
Right, Gabriel, so given some of the questions here that you've raised about the efficacy of some of these interventions, why do you think the government is so insistent on things like mask mandates and vaccination passes? What is the kind of underpinning idea here? What is motivating the government?
In the absence of good scientific evidence to justify the government's regulations, it is a matter of speculation. Why are these impositions being made? I don't know for sure. One suspicion is that COVID-19 is going to stick around, but because of natural convalescence, as well as vaccinations that have already taken place, you're going to see the divorce between deaths and cases continue. And as long as government is forcing us to behave in symbolic ways, they will be in a better position to claim a win out of the inevitable easing of COVID-19 strain. A second option is that keeping these regulations in place keeps up the idea that they worked in the past. And I would say this is the biggest disagreement between someone like Professor Shabir Mahdi, who has overseen a clinical study into how many people have actually had COVID, and someone like Dr. Crisp, who works for the government and tries to promote its view of the world. Shabir Mahdi looks back on the last 2 years as a devastating failure in which regulations have not effectively curtailed the virus, and that's why 9 out of 10 people have already caught it. Whereas Dr. Crisp looks back and says it's been a tremendous success. The regulations have worked before, and that's why we have to keep them up. So I think, unfortunately, the political argument is overwhelming scientific reason at the moment, and that this requires ordinary South Africans to stand up, wake up, and to seek truth from facts.
Gabriel Crouse, thank you very much. Let's hand over to you, our audience. What do you make of the ongoing health restrictions as discussed in this video? Leave your thoughts down in the comment section below. Also, if you enjoyed this content, you might want to hit that like button and subscribe to the channel. That will ensure that you get all of our weekday updates. That's every weekday morning at 6 a.m. My name is David Ansara. This is the CRA. Until next time, take care.